Hiya, hey lovelies. Welcome back to my channel. This is your girl Sarah, and if this is your first time watching this channel, you're most welcome. Go to the subscribe button and subscribe so that you get notifications when we post new videos. And if you're a return subscriber, thank you for coming back. I appreciate your effort, and also appreciate when you go on and engage in the comment section. Comment with any questions you have, or comment about any videos you want to see that you want clarity on. I'll be happy to go on and explain to detail. Feel free to ask any questions where you need clarity. I think in case I don't expound on anything, please feel free. It's always good to share what you know. You never know whom it may help out. Okay, so I'm just sharing. Today we're going to share about the assessment marking criteria for postnatal. Then remember, this is from the Apie, which is the assessment part of the Apie. The Apie has assessment, planning, implementation, and evaluation. So we are still doing the assessment. The specific assessment we are doing today is the postnatal Apie, and just as I said, we are going to look at the assessment, marking criteria, and then we're going to look at how to. I'll try to give two ways of how to. One, the brief summary, and then I'll go into another detail. Okay, remember to always ensure that you read the scenario, read the background before approaching the patient in postnatal. This will help you to not miss out on important information that is in the scenario. Okay, so this is the assessment criteria marking guide for the postnatal Apie. So as we see, there are 1, 2, 3, 4 up to 16. So I'm going to read through, starting from number 1. Just make sure you're not, because I was unable to. I'm just learning how to edit, so I don't know how to put the soft copies to the screen so that you can just copy them. However, I just request you to listen in. I'm going to go one by one until 16 so that we are able to follow up. Okay, so number 1 introduces yourself to the woman, stating the name and the role. Like, my name is Nachintu Sarah, or my name is Nampija Sarah, and my role is the midwife, or I'm going to be your midwife for today. And then number 2 checks ID with the person, brackets, the person's name is essential, and either date of birth or the hospital number. It's okay to also ask for both of them. So you ask the mother, can I please confirm your name and your date of birth and the hospital number? And then she will say, my name is Nasuna Jamira. My date of birth is 12 January 1994, and my hospital number is 1234556. Okay, so you check on the wristband. Make sure you check the wristband to confirm what she's saying is the same as what is on the wristband, the white wristband. Okay, or if you have any documentation that it tallies with that. Okay, then cleans hands with the alcohol hand rub, washes with soap and water, dries with paper towels following the WHO guidelines, and applies appropriate PPE. You should follow each and everything. So you either use hand rub or you go on to wash your hands with according to the WHO guidelines, which are 8 steps. The 8 steps go by palm to palm, the dorsum. Then we interlace, fingers interlaced. So you make sure you interlace this side, interlace this side. Then we go into fingers interlocked. You do this side and also do this side. You come to the this. You come to rubbing of the thumb, you come to rubbing of the tips, you come to rubbing of the tips, you come to wrist rub. Rinse your hands and then you dry with a paper towel or you air dry for 30 seconds, okay? Then apply PPE, that's your apron, and then your the apron and the mask, okay? Then number 4, reviews history, confirms the situation. Those are the presenting symptoms, okay? Then we go on to confirms background. We are looking at the medical history, antenatal and intrapartum care to date. So you ask the mother all those underlying, if she has any underlying medical conditions, maybe diabetes or hypertension, all of that. Okay, and then you ask the mother also if she's also on any medication. 6, gains consent and explains the reason for the postnatal check. Since you already know the mother's name, so it's important that you use the mother's name when addressing her, okay? When you take her, oh, hello Jamila, I would like, I'm going to do a postnatal check on you, whereby I'm going to do a physical assessment and do a social assessment and also psychological assessment. Is that okay with you? She has to give you a head if it's okay to go on, okay? Then we go on to number 7, which is completes a full postnatal assessment and verbalizes maternal observations, temperature, pulse, blood pressure, respirations. On top of this, add the oxygen saturation, please. Temperature, pulse, blood pressure, oxygen saturation, please, should be added, okay? Then 8, inquires about the perineum and breast comfort. In addition to that, also you have to ask about the uterus and the bowels, okay? And number 9, considers and discusses the woman's mental health and well-being, which are going to detail when we are doing the how, okay? Accurately documents all maternal observations on Muse chart, provided the temperature, pulse, blood pressure, respirations, passing urine alert, pain score, lochia, looks well, assess well-being or clinical deterioration using the chart, okay? Then accurately completes the Muse chart, signs, dates, and adds time and monitoring frequency on assessment charts. So this will include like the neural response, the amniotic fluid, or looks unwell, okay? Then number 12, identifies the maternal observations that are a cause of concern to the examiner. So maybe there are 2 ambers or there is 1 red, okay? But at least there should be 2 ambers. Then number 13, addresses health education sensitively to include healthy eating, fluid intake, resting when tired, breastfeeding advice, postnatal exercise including pelvic floor exercise, and care of the perineum. Number 14, recognizes that a plan of care is required because of the abnormal findings in the maternal assessment. So however, most times on the plan of care, what you'll advise, you check on the Muse chart. Most times, according to the ambers you've got or red, they'll give you the deadline of what to do next. So that will help you to guide you during the plan of care, okay? Most times you will refer the patient to the hospital if she has any problem, okay? Then number 15 is verbal communication is clear and appropriate. The examiner is very interested in hearing whatever you say clearly, okay? And then number 16, act professionally throughout the procedure in accordance with the NMC 2018, the Code of Professional Standards of Practice and Behaviors for Nurses, Midwives, and Nursing Associates, okay? Okay, so let's go into the how. Postnatal Apie, okay? So, number one, this is a brief summary of the how, but things that you should really include, okay? So, number one, you're going to assess the scene for safety to make sure there's no falls. There's nothing on the floor that may cause someone to slip or fall over. Then you're going to check the scene for privacy, that is closing curtains, open windows or doors that will expose the mother's body. Wash hands according to the World Health Organization procedures. Those are 8 steps. I've already explained that. Introduce yourself. My name is Guanzu. My name is Sarah, and I'm going to be your midwife today. Confirm the patient details, just as I've said. Confirm them, or can I confirm your name and date of birth, please? So the mother will say, I'm Nasuna Jamira. My date of birth is 12 January 1994. My hospital number is 123456. Go on and ask for allergies. Those are the first 6 steps of every procedure that you're doing in assessment. So ask the mother for allergies. Do you have any allergies that you know of? Ask her if she has any allergies and does not have the wristband. Make sure you get her the red wristband, and also include it in her notes that the mother is allergic to this and this. And if she takes this medication, this happens, this is the reaction she gets. Make sure you also inform your colleagues, okay? Then we go on to review history. The history that you review is what you have on the scenario paper, okay? So we shall go on and do our maternal observations, whereby we have the blood pressure, the pulse, temperature, oxygen saturation, capillary refill, and respirations. Just put in your mind that the observations are 6. So every time you're doing observations, you'll have to ask yourself, what have I forgotten? 6. Blood pressure, pulse, respirations, capillary refill, oxygen saturation, respirations. Then we go on to the physical assessment. What do you have for the physical assessment? Physical assessment also includes the maternal observations that we've done, okay? So we have inspecting of the breasts. Do not touch. Do not touch when assessing. So you view the breasts, are they too? Are they engorged? The appearance, make sure you wrote everything that how they appear. And then you go on to the abdomen. Sorry, it's a bit cold. You go on to the abdomen and you palpate for involution and also distension, and also ask the mother if she has pain. Remember to score the pain on the scale of 0 to 3, with 3 being the maximum. That's what we use, okay? Then the mother will tell you which degree of pain she feels, okay? Then we shall go on to inquire about the bladder. Ask the mother, is she passing urine without discomfort? Is she passing the urine frequently? Does she feel pain when passing urine? Okay. Then you go on to inquire about the bowel movement. We're going to ask the mother, are you passing any gas? Are you passing stool? Or are you having constipation? You need to know all this, because if you don't address it, some mother will end up getting very constipated during the period without asking for help, okay? Then we're going to inquire about the perineum. So when we're inquiring about the perineum, we're going to inspect it, look at the perineum and see if the mother was stitched. Are the stitches healing well? Are they infected? Then ask if mother has any tears or trauma. You're going to want to know were they repaired or not? Are they still? For the tears or trauma, you need to see, are they still bleeding or are they causing more pain to the lady, okay? Then we're going to look at the lochia. The lochia, you're going to look at the smell. You're going to also look at the color and the volume. Make sure you note everything down, okay? Then we are going to do a VTE assessment, and this is to rule out deep venous thrombosis on the legs, okay? So this will help us to check for the pain, swelling, redness on the mother's legs, okay? And then you also you're going to go on and ask the mother, have you been mobilizing? How far have you moved out during your stay in the hospital? Sorry, I was still saying, you're going to ask the mother if she has been able to mobilize, move around the house. You ask her how far she's been moving, like around the house. I should be able to go out, maybe to walk a bit, okay? And then you're also going to ask her if she has started exercises. Exercise, I mean the Kegel exercises. Those are pelvic floor exercises. Please remember to ask that about the Kegels. And then you're going to ask her if the mother was discharged with any medication. Is she able to take the medication? How is she coping? That's also important to know. Then we shall go on to do social assessment. Social assessment, you want to know, does the mother have help? Whom is she staying with? So if she's staying with a partner, or does she have any family who are helping her, and then helping her around the house, okay, support with the baby. And then you're going to need to also ask her if she's having financial support. If she has been employed, is she able to get maternity pay, you know? If she does not have support, how are you able to refer her, help her to get support she needs, okay? Is she self-employed, employed, non-employed? You need to know, so you find ways of helping her or to refer her to the right services, okay? Then we're going to look at the psychological assessment. 1, when you operate, make sure you're going to ask if the patient is safe. Is this a safe place to her to speak? Ask her, do you feel safe? Because if she doesn't feel safe, she's not going to be able to open up to you about what is hurting her or what she's going through, okay? Then we're going to ask her if the mother is anxious, if she's depressed, okay? Then we're going to ask her if the patient feels constant fatigue. You know, that exhaustion of non-resting, adjusting between sleeping in bed and all that, having housework to do and looking after the baby is quite tedious. So some of them have fatigue, so you have to ask her. Then you're going to ask her, is she able to eat? So you're going to ask her about, does she have loss of appetite? Is she able to do her daily activities? So you're going to ask her, are you able to perform your activities of daily living? Okay, like she's able to have a shower, to make herself something to eat or drink, clean her house. Is she able to do that, or she's unable? Then you're going to ask, then still you're going to ask the mother if she has any postnatal blues, or you may simply term it as mood swings, okay? And then you're going to ask her if she feels overwhelmed caring for the baby. And then you're going to ask her if she's what else? Okay, after that, then go on and fill in your Muse chart and perform a handover. Remember to always hand over, explain to the woman what you've done and your findings as you're explaining to the examiner. So you're going to verbalize the Muse score as your handover. So you identify the area of concern according to the findings you've got, and then you state the differential diagnosis and then the recommendation. hope that is quite a bit precise and clear. So we're going to go on to another detailed way of how to do postnatal assessment. Yeah, let's start number 2. Then still you're going to ask the mother if she has any postnatal blues, or you may simply term it as mood swings. Okay, and then you're going to ask her if she feels overwhelmed caring for the baby, and then you're going to ask her if she's what else? Okay, after that, then go on and fill in your Muse chart and perform a handover. Remember to always hand over, explain to the woman what you've done and your findings as you're explaining to the examiner. So you're going to verbalize the Muse score as your handover. So you identify the area of concern according to the findings you've got, and then you state the differential diagnosis and then the recommendation. I hope that is quite a bit precise and clear. So we're going to go on to another detailed way of how to do postnatal assessment. Yeah, let's start number 2.